Hello, my name is Allison Warner, and I am the Chief Editor of Orthodontic Products. Welcome back to In the Sterilization Room with Jackie, where we talk with infection control and prevention expert Jackie Dorst about what you need to know amid the COVID-19 pandemic. For over 20 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She holds degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, glad to be back with you.
Hi, Allison. It's good to be here today. Thank you for rescheduling our interview. The viewers may not know, but we made it a little bit later today so that we could listen to the CDC's latest information.
Yeah, definitely. Yeah, so we'll be covering that today. But to get started, the CDC updated their guidance for dental settings on May 19th. Is there anything that affects the orthodontic practices in that updated guidance?
Well, there were just a couple of changes, if you will, or I shouldn't say changes, additional information that was included in that May 19th update. And of course, CDC focuses on the health and well-being of the United States. And with the dental division of the oral health division of CDC, they look at what's safe for patients when they come into the dental office and what's safe for the dental professionals so that we don't have a risk for transmitting diseases from one patient to another patient or from patients to ourselves. And that's become very important during the COVID-19 pandemic. And CDC, as more data, more research is coming in, then they change or adapt their recommendations for interim guidance. Now, this is guidance that just applies during the pandemic. That doesn't delete standard precautions. Standard precautions that the dental professions always adhere to still apply. So there were a couple of changes or updates with it. One was after you finish treating with a patient and with aerosols procedures, that they actually looked at a wait time for disinfecting the room. And another one was on the PPE. And even in the webinar today, there was quite a bit of information on airflow in the treatment facility and how you can increase maybe the air changes and removing any microorganisms that might be floating in the air. So they covered all of the topics, everything that's on this guidance in the CDC document. Was covered today, and we got some clarification on the topics that I just talked about. So I would urge every one of the readers to download a copy of this and read it and interpret it for their orthodontic practices.
Okay, well, let's dive a little bit deeper because there were a lot of questions that came out of the guidance. And so the CDC held its first ever dental-focused COCA live webinar today.
Yeah.
And that's why we're a little delayed in terms of our taping time. So what was relevant to orthodontists in your opinion?
Well, one of the first questions that came up, and I know the AAO COVID-19 task force with it had contacted me and said, Jackie, what does CDC say when they are advising us to, after a patient leaves, to leave the room empty for 15 minutes? And so in discussing this, the purpose of it is to let the heavy wet aerosols that could have been generated during splatter, splash, aerosol generating procedures to settle out of the air. So CDC's recommendation, and we have to remember this is for the entire dental profession. CDC makes guidelines for oral surgery and perio and general dentistry, as well as orthodontics. Ortho is at the lower spectrum of those splatters and splashes because when we pick up, as we've talked before, when orthodontists pick up a handpiece, most frequently it doesn't even have water going through it. So minimal splatters and splashes with it. Now, the reason for that 15-minute wait time was because if there have been lots of aerosols created and they're floating in the air, it's believed that the SARS-CoV-2 virus can be transmitted in those heavy wet droplets. So allowing that 15 minutes allows those heavy wet droplets to settle and reduces the risk of them being running across contamination for anyone who would come in to clean. So CDC again suggested that 15-minute wait time after aerosol generating procedures.
Okay.
So what you would do is the person providing the care, the orthodontic assistant or the orthodontist, would leave the treatment room, and hopefully they've been able to configure a aerosol generating room, maybe one that they have repurposed, such as a treatment coordinator room, or they've put in barriers in between in their open bay, in between those chairs to help confine those aerosols. So the patient would leave that area, and then we would wait 15 minutes before we go back in and disinfect and clean. So we're going to disinfect, remove all of the barriers that are on the chair or the unit, and then replace the barriers, and then reset that room for caring for the next patient. Now, does that mean the entire open bay has to stay vacant for 15 minutes? No.
Okay.
If we have the orthodontic assistants that are in the open bay, and at this time patients must be at least 6 feet apart, and it was specified in the update on here that there should have been some sort of partition or aerosol barrier even put between chairs in an open bay. And so if we don't generate those aerosol procedures, we're doing just a routine arch wire check or delivering an aligner to a patient, then we can go ahead and proceed and disinfect that unit, reset it for the next patient. But it was quite specific, and it included even how to modify the facility with the guidance that was updated on May 19th.
Oh, okay. Okay. Well, another question that came out of the May 9th guidance was about PPE and specifically N95 respirators. Did they talk about that on the call to give any clarification?
Yes, there was quite a bit of information, and I was really happy to hear that because I think it made it more simple for the orthodontic profession. There's been so much focus on the N95 respirators and that there's a shortage of them and they're not available, and there's price gouging that is going on from some of the manufacturers that are sending them in. And what CDC specifically said under the PPE section on it was that during aerosol generating procedures, it would be best to have on an N95 respirator if supplies were available. If supplies were not available, then use the highest level procedure mask with a full face shield over that mask. So it's in printed black and white that CDC is recommending those surgical mask, procedure mask for us, even with the aerosol generating procedures. And that's for patients that are not identified as infectious. And that's the majority of our orthodontic patients. Now, obviously, if a dentist had to see a COVID-19 infected patient for a dental emergency, then obviously they're going to wear full aerosol protection with it. But for us, and even with generating aerosols, CDC said if it's a non-infectious patient, then use that surgical mask, the highest level available. So that would be a level 2 or a level 3. A level 1 mask under the ASTM classification for it, they are not as fluid resistant, and they only give like 95% filtration, both for both bacterial and for particle size. You get up to 98% filtration and a higher level of fluid resistance with a level 2 and a level 3. So we've been so anxious about that shortage of the N95 respirators, and I continue to explain when I do training sessions for orthodontic offices prior to them opening up that you've got to wear your PPE right, or it won't provide you the protection. It'll leave you with that risk. So if you are wearing that N95 respirator, it's got to seal tight around your face. You have to do a seal check each time with it. And if it's too big or too loose, it's not providing you maybe even the protection that you would get from a level 2 or a level 3. Right. And CDC even went further. You've heard about the extended use and reuse of these N95 masks because there's such a shortage on it. They were real specific with the number 5 is the key. You can take it off and put it on 5 times.
Hmm.
You can wear it for extended use for, like, as they refer to, a full shift for like 8 to 12 hours. And so that's where they get the 5 days, is if you wore it 8 hours without taking it on and off. But if you take it on and off 5 times in one day,
Hmm.
then that's going to be the maximum. So it's the number 5.
Okay.
You take it on and off for 5 times with it. And at that point, it's going to be pretty much even just physically worn out. The straps get loose on it. It gets soiled on the inside of it.
Right.
Yeah. And they were even specific about the prices. They had talked to they have one of the CDC people talked about the masks, the KN95s, those international masks that were
Mhm.
not meeting the standard. NIOSH had tested them, and over 58% of the masks they tested failed.
Really? Oh,
They did not meet that 95% filtration on them. They failed with them. So of
wow.
course we know that NIOSH has that list of approved KN or K95 mask with it. So I'd much rather use a US manufactured filtration mask, a surgical mask, than go with a less effective N95. And the price they stated in there is if you're paying over $3 per N95, then you need to look at, consider, are you being gouged with the pricing? If you're paying under $2, you need to look at the quality, because it's probably
Ah,
not an accepted quality. So CDC actually put it in that $2 to $3 range. And I've heard orthodontists call me and tell me, we found N95s, but they were $20 a piece.
oh my gosh.
Oh yeah. I just really feel for the offices that are going through there. So that was a good clarification to come
Mhm.
out, good information in this live webinar.
Well, that's great. Okay. Well, another issue that was addressed in the webinar was air purifiers. What's your take on that discussion?
Oh, I've been doing so much research and I've learned so much on aerosols and airflow and air changes per hour and HEPA filters and UVGI irradiation. And I go, this is above my pay grade. I'm a microbiologist, I'm a dental hygienist, but thank goodness there are experts out there that are willing to share their information.
Right.
Free flow engineering, the engineers with it, they've actually gave me a course. They just sat down and gave me a one-on-one course
Mm.
on air engineering and air flows. But CDC addressed quite a bit in the webinar today, even more than is in the printed document.
Hmm.
And one of the specifics that came out of it, let's see, it was Alberto Garcia. He was the engineer that talked about the airflow and with being concerned about microorganisms and particulates in the air. And Mr. Garcia told us that we should have if we're going to look at an air purifier to help remove any aerosols in the operatory, that it should have a MERV rating of at least 13. And I go, okay, that gives, we've talked about HEPA filters and all. So what a MERV rating refers to is the minimum efficiency reporting value. So it's actually evaluating how effective that filtration and the airflow is through the air purifier. So we want to look for that MERV 13 if you're investing in an air purifier for your orthodontic office. And then the other thing is the placement of that air purifier in the treatment area. It shouldn't be right next to the orthodontist assistant or the orthodontist at the head of the patient, but it should be at the feet of the patient.
Mhm.
Because we always want to be pulling clean air over our head and removing the aerosols away.
Oh.
So if we pull it toward, say, the feet of the patient,
Mhm.
then if the air purifier is put at that location, then it's always going to be pulling clean air from behind us and
Okay.
evacuating it toward that air purifier. And that's one of the things that not many people think about, when we're looking at air purification. And CDC, Mr. Garcia even mentioned the UVGI, that it was a possibility. That's ultraviolet germicidal irradiation, to put those units in the CDC printed document. When you look at it, it says to do it as high or ceiling type, as an adjunct to purifying the air. And they goes on to say any of these air mitigation devices that you're looking, the aerosol mitigation devices, please get an air engineer, an ASHRAE engineer, to advise you on that, so that you're not spending money for things that may not be effective at reducing the risk and providing healthy air, healthy PPE, effective disinfection, and reducing your risk. And then, there's a lot of good information in the printed document. The other thing that Dr. Michelle Newberger, she's the dentist that is with the CDC staff, and so she focuses on clinical practice with it. And one of the things that she emphasized was looking at your standard precautions, because standard precautions, the normal sterilization, it still applies at this time. So it's time to review that. And then the other thing that's mentioned in it is reopening the office and making certain that all of your equipment is up to standards, that you have cleaned your sterilizer and done at least 3 spore tests are supposed to be done before it's put back into use, if it was shut down for, say, 2 or 3, 4, 6 weeks with it. So you want to verify those 3 sterilization cycles, testing your ultrasonic, testing your water lines, shock the water lines and test those. So it's comprehensive on us reopening our practice, but I sure did appreciate having the live webinar that answered some of those questions and clarified some of the topics. And then also that webinar is going to be saved. So anybody that didn't get a chance to look at it, they can go back and review it and use that as part of their training for their reopening of the office.
Yeah, I think that'll definitely be a very valuable resource for people to check out. Well, Jackie, thank you so much for going through all of this and providing some insight. We will be back next week with our next episode of In the Sterilization Room with Jackie Dorst. We are here to help you as you manage life amid the COVID-19 pandemic. And if you have any questions about infection control and prevention related to reopening your practice, leave it in the comments section and we may answer it in a future episode. And in the meantime, be sure to check out the latest orthodontic industry news at orthodonticproductsonline.com. Until next time, take care and stay safe.
Be safe.